I'm here to talk about two brilliant research projects. One that started in 2011 and that ended in 2013, and that started a KTE phase post-2013, and an emerging research project called weSpeak, which kicked off last year. My name is Wesley, and I'm from Africans in Partnership Against AIDS. I'm the prevention coordinator there, and I've had the opportunity to work along with my organization as an investigator on both of these projects. So what is weSpeak? Well, weSpeak is a community-based research project that's really taking place in 5 cities across Ontario, in London, Toronto, Windsor, and Ottawa. It has a research program that integrates KTE activities along its way. Really, what are we trying to do? Well, we're trying to get men to appreciate the conditions that help HIV to spread. And by conditions, I'm talking about the structural conditions, trying to get folks to understand how underemployment, how poverty, how anti-Black racism plays a role in perpetuating ideas, plays a role in stigma, plays a role in how we think about sex, but also getting guys to think about the conditions in terms of their interpersonal relationships, getting them to think about what it means to be a man, what is masculinity, what is it that people expect of us as a man, what does it mean to be straight or heterosexual, and acknowledging that these conditions, these things, have an impact on how we think about our sexual health. It also means we want to strengthen their commitment to HIV. We want them to come on board. For many years, straight Black men, for various reasons, have been left out of the response. And so now we're saying, hey, it's time, come, be a part of this. Tell us what you think, share your ideas. And of course, it's about strengthening the networks that make all of this possible. So the various ASOs, but other organizations with whom we work. Well, what are the issues? The issues have been the same for the iSpeak project as they are for the weSpeak project, and they're rather straightforward. We know these issues very well. ACB people are especially vulnerable to HIV. We know that ACB people who are infected with HIV through heterosexual contact account for almost 20% of all HIV positive people in the province, even though ACB people as a whole make up less than 5% of the province population. So as Black folks, as straight Black folks, men are overrepresented when it comes to HIV. We might also add, about their overrepresentation of Black men, for example, in our criminal justice system, and so forth. It's estimated that ACB men account for the majority of ACB people infected with HIV through heterosexual contact, but ACB men are less likely than ACB women to be tested and diagnosed with HIV. And I might add to that of course, the proportion of women living with HIV in Black communities is equally very high. So iSpeak. So everything begins with iSpeak. iSpeak is kind of the genesis for weSpeak project, and it really emerges organically. And what I mean by that is that in the 2009, 2010, APA, along with other organizations, begin to start noticing changes, patterns in their service provision. They start noticing that men are not there, that they need to start reaching out to men, but somehow that the programming isn't quite there as well. And so that triggers an informal research, a study that was done by APA and its partners, which then leads to a request by ACHO. It was presented at an ACHO council meeting, a request that a formal study be undertaken to explore the needs and priorities of heterosexual Black men. And so from there, Winston Husbands, the principal investigator on this project, was able to get a Catalyst grant, and we did interviews both with men living with HIV and men who did not know their status or who were HIV negative. We talked to service providers, we talked to researchers, and then we put that all together in this really cool report called Talking Black. And Talking Black is really important because it's the first report of its kind in the sense that it allows us to finally listen or read some of the views of these men that we talked about concerning what it means to be a man, concerning their experience in the healthcare system, regarding what they think heterosexuality means to them and why it's relevant in their health. First of its kind in Canada, and certainly first of its kind in the province. And so what were the guys saying? Well, they were saying a lot of things. And sometimes they were saying contradictory things. But that's okay, right? And some of the more salient points here, well, that there are a lot of stereotypes out there about straight black men. Part of those stereotypes, can I just speak like this? Yeah. Well, black men don't care about their health. Black men are reckless. All black men are, naturally straight. Real black men can't be gay or bisexual. And that people living with HIV are people who have sex with men. That if you're a straight man, you're immune to HIV. But then there were other things that came out through these interviews, right? That, hey, as a man, it's important to talk about how you feel. And sometimes that's challenging, but there's something rewarding. There's something fulfilling when you do this with other men. There's something fulfilling and rewarding when you do this with women, your partner. And it's possible that men also do want to be a part of the response. And that culture is an important piece here in terms of shaping the way in which men think about sex, heterosexuality, and HIV, but also in terms of understanding what they're prepared to do in the response. We took those findings, and of course, meaningful research with an impact is research that allows us to take this, what we find, our data, the evidence, and then translate it into something meaningful on the ground. And we decided we would produce a film, and this film would talk or look at, how black men deal with vulnerability and emotions. And we came up with the idea of doing a short film around testing, and I'm going to show you this film now. It's about 6.5 minutes long, and then I'll continue with the presentation. 4 minutes? Oh, shame. So what I'll do, I will show you the film. And maybe additional questions, I can answer that in the Q&A. So this is what good KT can look like. So we're trying to take up these themes around masculinity, around manhood, around heterosexuality. In fact, many of the people have expressed that, well, are those two guys really straight? And so that in itself is a way for us to kind of get into a conversation about what sexuality means, particularly in the context of two self-identifying straight guys, right? Now back to iSpeak, or weSpeak rather. weSpeak is in its second phase right now. We're conducting interviews and doing data collection. It's a 5-year program, and so over the next couple of years, we're going to be working on the survey. And in the last year, in the 4th year rather, we're going to be doing concept mapping, which allows us to bring policymaker and service providers into the equation to kind of think about some of the findings and what we're going to do moving forward. And of course, KT activities throughout. And for more information about the weSpeak project and how you might be able to get involved, you can always check out the website. So www.we-speak.ca, or have a word with me after this presentation. Yeah. Thank you.